Hello, I'm Dr. Alfred Davis Jr., your most trusted wellness specialist, and today I want to talk to you about understanding autoimmune disease. This is a situation in our country that is just literally devastating people's lives. As we go through the presentation, you'll begin to understand the impact of autoimmune disease. We have our information up on the screen here. I have several degrees that I would like just to review with you. Sometimes I forget what they mean myself. But I'm a DC, which is a chiropractor. I've been a chiropractor for close to 34 years. I'm also a diplomate in the American Chiropractic Board of Sports Physicians. So I used to do a lot of work on the field with athletes, being the on-the-field physician for soccer games and football games, even worked with the Giants for a short period of time. And so that is my board status as it relates to sports injuries. I'm also a diplomate in the American Academy of Pain Management. That was a very rigorous course that we had to take a test on to be able to be certified in being that. I'm a fellow of the International College of Chiropractors. And finally, and most recently, I'm a certified medical examiner, and that is for individuals who either drive a bus or a tractor trailer. We can do the examinations for DOT so that drivers can re-up their license to be able to do DOT exams. So, a little bit about me. This is our information, Davis Integrated Medicine, 309 Orange Road in Montclair, New Jersey, and our website is davisintegratedmedicine.com. So, a few goals with this video. First and foremost, I want to define some terms for you, so there's just a lot of confusion out there as it relates to what is an autoimmune disease, what isn't an autoimmune disease, and just a lot of confusion in terms of the way people treat the disease, and also whether or not it's a death sentence, meaning that it's not something that is not reversible. We have found strategies and protocols that tell us and show us through our clinical experience that these diseases in most cases are reversible. And so that's what I would like to be able to go over with you today, because chances are very good that you probably already come to our office. You're probably in the process of reviewing your labs so that we can determine exactly how we can reverse these autoimmune diseases. Secondly, we're going to review the basics of the immune system. Your body's immune system is just so amazing. To give you an example, if you go out and you have a wonderful meal at your favorite restaurant and you enjoy your meal and you get home and all of a sudden if your stomach begins to gripe or you begin to feel sick, that is your body identifying something that you ate, even though it tasted good, something that you ate was toxic or poisonous to your system. And your body is very, very effectively, in most cases, getting that, whatever that toxin is, out of your system, sometimes quicker than we want it to be able to prevent your body from being harmed. So your immune system, extremely complex. No scientist or no laboratory could ever detect what your body detects when you take something into it. Next, we're going to go over the cause of autoimmune disease, and that's really very, very important because most people don't understand how an autoimmune disease starts. It's kind of like it's a mystery. Like all of a sudden I was fine, and all of a sudden I got a diagnosis of cancer. I got a diagnosis of diabetes. Or I got a diagnosis of lupus or MS or whatever it might be. And so I'm going to go over with you how exactly can a person develop an autoimmune disease. And then lastly, we're going to lay out the treatment options in terms of the strategies and protocols that we have created in our office to be able to reverse these types of diseases. So, I want you to grab a piece of paper and a pen. We're going to be giving you a lot of really good information. Some of it may be a little bit technical, but I feel that our audience is such that you'll be able to at least understand the overviews of the things that we're going to look at. Because the bottom line is that when you're dealing with auto disease, you really have to be very detailed oriented. You have to take a look at markers and results from labs very tediously to be able to determine how this particular problem or disease can be reversed. So it's a very tedious process, but I've taken it upon ourselves, and we've taken it upon ourselves here at Davis Integrated Medicine to be able to review these results and to identify the proper protocols for people. So you want to take notes, write down any questions that you might have, and I will answer them for you when you come into the office. I'll be more than happy to do that. The reason that we basically do the video is just there's so much information. I don't have the time in the office to be able to go over everything with you, but this video will probably give you about 80 or 90% of all the things that I would say to you in the office, and then I can answer any questions that you may have outstanding. I want you to keep an open mind. We just had the patient the other day say, when they were starting the program, they said, there are a lot of doctors that say that they can treat and reverse various types of autoimmune diseases, and I've been going to different kinds of doctors for years and years and years, and I still have the problem. I want you to keep an open mind because the technologies and the protocols that we use are different from your traditional type of treatment of these kinds of diseases. And what you'll see as we go through this is that our approach is totally different. We recognize the fact that you have to detoxify a person, you have to provide the appropriate protocols in terms of nutrition, etc., and we also have to be able to provide the proper technologies so that we can reverse the damage that has been done to the cells in an autoimmune disease. And finally, I want you to know that help is on the way. You may have been suffering for years with various types of autoimmune types of diseases. You may not even know that it was an autoimmune disease. Okay, but after this workshop, you're going to understand much better what an autoimmune disease is and how you can reverse it. So, this is really about you, but people are always asking me questions about myself. So I'll just go through a very quick CV for you. I attended Seton Hall University. I majored in mathematics for 3 years. I also attended Bloomfield College and graduated from there, getting a degree in disciplinary studies and life sciences. I attended New York Chiropractor College, and at that time, New York Chiropractor College was in Long Island, New York, and I graduated with my DC degree from New York Chiropractor College. I've been a member of the New York State Board, New Jersey State Board of Chiropractic Examiners. I was actually president for a short period of time. I have been a past board member of the Council on Chiropractic Education, which is a subset of the U.S. Department of Education. It kind of oversees all of the education that occurs for all the professions and schools in our area. I'm also was a president of the American Black Chiropractic Association. I'm very proud of that. As I mentioned before, I'm a certified medical examiner to be able to provide drivers for their DOT licenses. I'm a diplomat in the Chiropractic Board of Sports Physicians, diplomat American Academy of Pain Management, and finally a fellow in the International College of Chiropractic. Enough about me. Now the rest is about you. So, autoimmune disease is the fastest growing epidemic in our country worldwide. Okay? It is a component of over 188 diseases and counting. Diseases like endometriosis, autism, fibromyalgia, multiple sclerosis, Lyme's disease, diabetes. These are all diseases that are of the autoimmune ilk. 90% of all thyroid problems are also issues with autoimmunity. So you can see that autoimmune diseases cover a very wide variety of problems and diseases that can affect the body. Definitions for you. The immune system gets confused and begins to actively attack your own cells. That is the definition of an autoimmune disease. So where at one point your body, some organ, was working fine, it was producing and eliminating and providing all of the functions of that particular organ, and then all of a sudden something happens to that organ and your body begins to attack itself. That is the definition of an autoimmune disease. Now, there is a difference between an allergy and an autoimmune disease, and I want to make that very clear for you. An allergy is a situation where you walk into a house, let's say for example, and there's a cat there, and let's say you're allergic to cats, okay? And so all of a sudden your eyes begin to water and you begin to sneeze, and you begin to maybe get a sore throat, or your throat begins to get a little rough, and all of this reaction is as a result of something that is external to your body. You walk out, you inhale some pollen, some ragweed, and all of a sudden you start sneezing. That is what an allergy is all about. Autoimmune disease is something that's totally and completely different. An autoimmune disease is a situation where your body on the inside begins to recognize something that was once good as something being foreign, and as a result of that, your immune system begins to attack on the inside of your body. It has nothing to do with external. It's all about on the inside of your body begins to attack itself, hence autoimmune disease. Now, unfortunately, for many of the autoimmune diseases, there really hasn't been a specific cause for why it occurs. But what we basically do is we perform the necessary labs, do the necessary testing to be able to determine what is it in your body that's become inflamed. What toxicity in your body is causing your body to attack itself. Okay? Once we can begin to find that out, then we can begin to create strategies to be able to begin to help you. So, diagnosis. Antibodies are found on the blood work that you'll either bring to me or we will send you out to receive so that we can identify specifically what the problems are. The name of the autoimmune disease only lets you know what tissue is being affected. So, for example, if you have a situation with the covering of your nerves and it begins to develop an autoimmune reaction, we call it multiple sclerosis. If you have a situation where your connective tissue begins to attack itself, we call that condition lupus. If you have a situation where your thyroid, because of toxicity or some changes in hormones, begin to attack itself, we call that disease Hashimoto's. If you have a situation where your pancreas becomes insulin resistant and your body is the pancreas is no longer functioning the way that it should, and the pancreas actually begins to attack itself because it is insulin resistant and the insulin is no longer putting the key into the cell and opening up the door so the sugar can come in, we of course call that diabetes. And lastly, if you have a situation where your joints become achy, sore, arthritic, inflamed, we call that situation rheumatoid arthritis. So depending on what condition is experiencing the inflammation or the attacking of itself, that basically determines what the name of the disease is. But it's all really basically the same type of situation. The body recognizes or thinks that something is foreign in the body, or maybe there is something foreign in an organ in your body, and the body recognizes that and it begins to attack it, and it begins to attack its own tissue. So under the surface, 50% of the people who find out that they have an autoimmune disease already have another one going on. So an autoimmune disease doesn't just isolate itself to one area, right? If you have toxicity, or if you have infection, or if you have inflammation, that is something that can spread throughout the entire body. And the fact of the matter is that you may not feel any different as this is occurring, but as this condition begins to increase and your body begins to attack more and more cells, now that begins to affect the functioning of your body. And as a result of that, when the function begins to not work properly, then that's when you go to your doctor, and your doctor identifies that there is a disease, so to speak, that you're now experiencing, and your doctor more than likely will probably write you a prescription or prescriptions to begin to take to suppress that reaction that that he's finding. And what you'll find out as we go through this workshop is that that's great for the short term, but the fact of the matter is that it's really not a good idea to suppress the one system, your immune system, that protects you. It's not a good idea to suppress your immune system for an extended period of time. So certainly medications have their place in the short term, but when you begin to talk about months and years, we have people who've come in literally with shopping bags full of medication that they've been taking for 10, 15, 20 years, and they're suppressing your immune system. That is a downward spiral. That is not going to result in a good outcome. Most times, as I mentioned before, the autoimmune disease comes with no pain or no symptoms until the damage is done in the underlying tissue, or a substantial amount of the underlying tissue has been damaged. So, in our country, people kind of throw these terms around. I want to be able to define for you the differences. People talk about prevention. They talk about cancer prevention and diabetes prevention and high blood pressure prevention. But then they also talk about early detection. Prevention and early detection are two completely different things as far as I'm concerned. When you talk about prevention, you're talking about actively doing something, being proactive and doing something to be able to prevent something from occurring. Okay, so you identify that maybe a person has a predisposition, let's say, for example, to diabetes. Let's say that maybe someone, maybe the mom or the dad had diabetes, and there's a predisposition to getting it. Prevention means beginning to do things to reduce the possibility that that person will also get the same kind of disease. Now, early detection, totally different. Early detection means that, yes, we have identified something that's wrong, but we're just going to watch it. We're not going to do anything. We're just going to watch it until it really gives us a problem. Okay? And as far as I'm concerned, that doesn't really make a whole lot of sense. So, because why wait until the disease has the opportunity to be able to take a foothold in your body and cause substantial amounts of dysfunction, and then you begin to try to play catch up and you try to begin to treat it with various types of drugs and medications? Why not just, if you identify something early, why not once again be proactive and begin to take steps to prevent the problem from getting any worse or prevent the problem from taking a foothold? So prevention says let's take proactive steps to prevent it and or reverse it, and that's what we're doing. We are reversing autoimmune disease. We're not waiting for it to continue to get worse or your medication has to be increased. We want to begin to take steps to stop it, prevent it from getting any worse, and then reverse it so that you can eliminate it, right? Early detection just says, let's just watch it. Let's just wait until it gets worse, and then we'll do something invasive, okay? And to me, that doesn't make any sense whatsoever. So, when you're talking about immunity, you've got to understand that there are two types of immunity in your body, and they work very, very differently. When these two types of immunities are out of sync, or one is dominant than the other, that's autoimmune disease. So, the first one is what is called the Th1 system. It's called the cell-mediated system. Cell mediation means that it's involved in attacking and destroying invaders like bacteria and viruses. So, let's say, you're around somebody who has a cold or is sick, and you get some of their germs, you get some of their bacteria, or whatever like that. When that happens and the body is able to handle it, that body will send cells out called macrophages or other kinds of lymphocytes to be able to envelop those bacteria, those viruses, to prevent them from spreading and from multiplying, preventing you from getting sick. That's what we call the Th1 system. Something comes into the body, usually that is something that is live, like a bacteria or a virus. The body attacks it and tries to isolate it and then tries to get rid of it so that you do not get sick and it does not have a chance to multiply. The second type of immune system is what we call the Th2 system. This is what we call the humoral immunity, involved in tagging invaders so that your immune system remembers them, for example, allergies or lupus. So in the Th2 system, the body has a memory. So for example, if you are allergic, let's say, to a cat, and you go around a cat, those symptoms automatically occur. You leave, and maybe a half an hour later, and when you're not in proximity to the cat, those symptoms now begin to disappear. You begin to get back to normal. However, if you go back to the place where that cat is, your body remembers that you were allergic to that particular type of substance that a cat gives off, and then your eyes begin to water again, and you begin to sneeze, and you begin to have a lot of allergic types of issues. So the Th2 system remembers. It's a humoral system. It remembers. If you are allergic to something and that allergen now leaves, when that allergy comes back, you're going to have the same type of problem. You have the same type of body. Same thing with food. Let's say, for example, if you're allergic to some kind of nut or tree nut or peanuts or something of that nature, if you make the mistake of eating it, you're going to have that Th2 reaction because your body remembers that it doesn't work very well with that particular type of nut. And so your body begins to go through that transformation of an allergic response. Okay? So the Th2 system has a memory, and it's humoral. So it remembers when your body comes in contact with whatever that allergen is that causes you to be allergic. And the Th1 system is a system that basically attacks invaders, attacks foreign materials in your body to try to isolate them from your body so that no damage is done. Now, if one system becomes dominant over another, that is the core finding of an autoimmune disease. So these two systems, the Th1 and the Th2, they should remain in balance. In other words, you need both of them. You need both the humoral side and also the side that attacks bacteria and viruses and stuff like that. When one of these systems becomes predominant and begins to do most of the fighting for you, it's just like soldiers. Instead of you having two armies to protect you, you're only focusing or having one dominant army that's protecting you, and as a result of that, things are going to get through the lines of defense. Things are going to get through into your system that are going to make you sick and cause you to have an autoimmune response. Most autoimmune diseases are Th1 dominant, meaning that most autoimmune diseases are situations where there's a virus or bacteria that invades the body, and the body just is overwhelmed and it doesn't have the ability to be able to isolate it or kill it off before it has a chance to lodge itself in a cell or somewhere where it's very hard to find. Almost all cancers, however, are Th2 dominant. Cancers generally are Th2 dominant, and that's the reason why you have the proliferation, the abnormal proliferation of cells reproducing and obviously causing tumors. Okay? People will say to me though, but Dr. D, I never get sick. The fact of the matter is that when this is all happening, you probably don't feel any different whatsoever. It's happening internally. Your body is trying to kill off these bad things that are going into your body, but if it begins to get overwhelmed, or if the repetition of the toxin or the inflammatory substance continues to be reproduced, then the body gets overwhelmed, and over a period of time, your body begins to get sick because the immune system can no longer fight it off, and you go for your annual physical, and you get your blood work done, or you get an examination done, and your doctor tells you that you have this type of disease, and you probably, didn't feel any different whatsoever, and you ask your doctor, like, but doctor, I feel fine. I mean, how can I have this? And so now you understand that is the body attacking itself as a result of what has occurred. So, can you tell me without labs? And unfortunately, no, because we use labs very, very diligently for us to be able to determine exactly what the core problem is so that we can help you. Okay? So the bottom line is if we do the evaluation and we tell you that we can help you to reverse something, if you follow the things that we ask you to do, we're going to be able to reverse that disease. But many times a problem will start after an illness. Problem will persist after taking a lot of supplements. Problems will occur, and you go from doctor to doctor to doctor to doctor, and each one tells you something different. Problems can start after pregnancy, and the reason for that is because when a woman is carrying a baby, there is nothing that's going to harm or attack that baby. Okay? So the body is in a different kind of mode where autoimmune disease does not have the ability to be able to attack, because the woman has a new life inside of her, and as a result of that, the body is very, very, very protective of that. And of course, you still have to be mindful of different kinds of environmental toxins and what you eat and what you drink and stuff like that. But the bottom line is that most women, other than like morning sickness, feel a lot better and a lot healthier when they're pregnant, because the autoimmune disease cannot attack. The body's not going to let anything like that occur in most cases to attack, because the baby is still there. However, after pregnancy, women will begin to get sicknesses and illnesses and those kinds of things and not feel the way they did before. It also can occur or be worse after a menstrual cycle. Changes in hormones, changes in levels in a person's body, that can initiate it. Problems that start after menopause. Once again, you have a change in the hormonal levels in a woman's body. And they also say that menopause also occurs in men. So you have changes in the hormones in a man's body. And as a result of that, you begin to develop different kinds of autoimmune types of diseases. And so people say that the problems are unexplainable, but the fact of the matter is that if you do the work and you review the labs and you know what you're doing and you figure out where the inflammatory markers are and what things are causing the illnesses that a person is having, it can be reversed. The reason that it's not is because most doctors just don't take the time to be able to do the type of blood work that is necessary to be able to get the details of exactly what needs to be done and what needs to be changed in order to be able to reverse one of these diseases. So, we all know the traditional approach, right? The traditional approach is suppress the immune system with drugs. Suppress the immune system with drugs. And that's what basically the traditional approach is. when you have an autoimmune disease and you're given a prescription, basically that the prescription is designed to suppress your immune system. Now, for the short term, that's fine. That's fine to suppress the immune system for a short period of time. But what do you think happens to your body when you're suppressing the immune system for months and years? Okay? The body is going to become accessible to other kinds of illnesses because that army, those cells, that defense system that we call the immune system that was once there is now no longer there. And so you become much more susceptible to various types of diseases. The thought process is that if your immune system is attacking itself, weaken it so that it can't attack. Okay? And like I said, short term, that's fine. But long term, when you're weakening the immune system over a period of time with traditional types of medication and prescriptions, long term, it's not a good thing. You're never going to reverse the disease, first of all, because you're suppressing the immune system. Okay? So it's a good strategy for short term, but long term, it is not a strategy that's going to allow you to be able to be healthy and well. So the problem is that you need your immune system. It's there for a reason, right? Your appendix, your tonsils, all of those organs once thought they had no use for them. They were taking them out like a dime a dozen. Now we realize that all of those organs, those immune function organs, your thyroid, your tonsils, your appendix, these are all organs that function in a way that protects your body. And even if you get them taken out, they can never take all the tissue out. So you still, even if you had your tonsils taken out, you still have tonsillar tissue. You still have tissue in your body if you had an appendectomy. Okay, so some of it is still left, but these organs serve a function. It's your immune system, and it protects your body. So, what's the cause? Very simply, what is the cause? Well, something gets into your body that causes the immune system to constantly turn on, get confused, or overreact. And that's the problem that we're dealing with here. You have to find out and get it out. You've got to detoxify your system and get those foreign objects out of your system so that your body has the ability to be able to heal. As long as those foreign objects are in there, they continue to cause inflammation and toxicity, and they're not going to allow your body to work properly. Some of the basic culprits are toxins, infections, food allergies, leaky gut, hormones, and genetics. Now we're going to go through each of these individually, but I just wanted to kind of give you an overview of each. Toxins, things that are in our environment, the air that we breathe, the water that we drink, the chemicals that are in our foods. These are all things that get into our body that cause our body to become dysfunctional. Infections, anywhere there's an inflammation or there's an area where something gets into your body and it causes inflammation or an infection, these are situations that cause the body to not function properly. Some people are allergic to certain kinds of foods, and they may be good for you. Like, for example, I got the test that we do here that determines what foods am I eating that are causing inflammation. And guess what? I found out that broccoli, as good as it is for me, causes inflammation. Doesn't really make any sense. So even if you're eating a good diet, we need to be able to find out what good foods that you're eating are causing inflammation in your body, because we need to eliminate them. We don't need to eliminate them forever, but we need to eliminate them long enough to allow your body to be able to recover once we have an opportunity to be able to detoxify it and to be able to get it back to functioning properly. Leaky gut. Very simply, leaky gut is a situation where you're eating foods and you're eating chemicals that are made of foods, antibiotics and extenders and preservatives and all kinds of chemicals. If you're eating fish, mercury, whatever it might be, you eat these foods, they go into your stomach, and then what happens is that because they're so toxic, they actually leak out of your stomach and into your bloodstream. That's what the term leaky gut means. You're eating something that whatever you're eating now has some kind of toxin in it. It leaks out of the stomach, leaks into the circulatory system, and then lodges somewhere in the body in some organ or muscle or gland somewhere and causes a problem. Hormones. We talked about before, elevations in different kinds of hormones can also cause autoimmune disease. If you have too much of, for example, estrogen, which we're going to talk about in a little while, that too much of the increased estrogenic effect can have an effect on your body becoming autoimmune. And then finally, genetics. We're going to talk a little bit about genetics. We're going to talk about how genetics probably only plays about 5 or 10% of a role in you getting a particular autoimmune disease. So it does give you a predisposition, but if you do the right things and you eat properly and you go through all the things that we're talking about here, we can overcome the effects of your genetics, what your mom, your dad, and other siblings possibly had. We can overcome that effect because we know from the Human Genome Project that genetics plays a very, very small role in your destiny and how healthy you can be. All right? So, toxins. You think they're a problem? Toxins are a huge problem. People don't understand how much toxins have an effect on your health. Most of us think that toxins can't get into our system. Yes, we do have a liver, we have kidneys that flush things out, but we are being so overwhelmed by toxins now, the liver and the kidneys just can't keep up. So they're almost unavoidable. We believe that we're in a toxic world, but we don't think that those toxins can get into our system. And the fact of the matter is that they do. 10,000 chemicals are added just to our processed foods. And when you go to the supermarket, about 85% of the food in the supermarket is processed. So when you think about that, and you're eating what we call the standard American diet, which we'll talk about in just a second, processed foods and chemicals are hurting us. There are 90,000 chemicals in our air. Factories, spew out all of these chemicals, and most of these chemicals have never been tested. So they're spewed out, and ultimately you will inhale them. There are tons of chemicals that are being dumped into our water systems, and this is the same water that we drink. Yes, it's purified, but the fact of the matter is that there's so many people taking medication now, it's impossible to get all the medication out of the water. So when you go to turn on your tap to get a glass of water, you are drinking trace amounts of other people's medication that they've taken, because it's impossible for the purification system that they have in place now to be able to get rid of all of the toxins in our water. Heavy metals. This is a huge one. Heavy metals are things that can really cause problems with your brain, but also other organs, causing autoimmune conditions. Mercury, for example, is about 50% of what they call silver fillings. So if you have silver fillings in your mouth, 50% of those silver fillings, more than likely, is mercury. Mercury is probably second toxic to like plutonium, which is radioactive. So mercury is extremely, extremely toxic, and most people, if they have any kind of silver fillings, they have them in their mouth. Why is it that when they either put these fillings in or they take these fillings out, you've got to have damping systems, and you have to have ventilation systems, and the dentist has to wear masks, and they have to be packaged in certain medical types of containers? Why is it that when you take them out of all of that stuff and you put them in your mouth, they become non-toxic? The fact of the matter is that they don't become non-toxic. They're still very toxic, and they can actually, the gases from mercury can actually move up into your brain and cause brain illnesses. You eat fish, depending on where you get your fish from or how much fish that you eat, chances are very good that you're probably getting some mercury in your fish. And then, of course, lastly, vaccinations. They're still putting mercury in vaccinations. And so we wonder why we have these various types of childhood diseases and how they are increasing. And no, it's probably not just one reason why we're having these problems, but overall I would say if you talk about the toxicity that we're living in our environment, it's probably a combination of different kinds of toxicities. But certainly the vaccinations that kids get with the mercury that's in them are certainly causing some problems. Lead. After a woman is pregnant and she delivers, that lead is released out of the body. It's stored in the bone, but once the pregnancy is over, that lead is released. It can become hugely, hugely toxic for the body. 20 to 33 major lipsticks were tested and found to have lead in them. So ladies, when you have your lipstick and you're putting it on, you lick your lips, chances are very good that you are literally absorbing lead into your system, because I guess lead is a very important ingredient in most major lipsticks. So we have to be careful about that. In a journal of the environmental health found that women between the age of 65 and 87, which had high levels of lead, were 60% more likely to die during a 12-year study. So lead can definitely shorten your life. It can kill you. And we need to be able to make steps to be able to avoid it. Very important study, and I'd love for you guys to Google this. The International Academy of Oral Medicine and Toxicology is a really fabulous and a great resource. If you search IAOMT on YouTube and you check out smoking teeth, you'll be able to see for yourself how toxic mercury fillings are in your teeth. And it'll literally demonstrate to you how toxic it is, and you may want to begin the process of getting those mercury fillings out, because it's not going to get any better. As the fillings decay, they're just going to release more mercury into your system. Nickel. Women who have breast implants, usually breast implants have nickel in them, and nickel can also cause cancer. Cadmium, found in cigarette paper and also in cigarette smoke. So it's not maybe you're not the one that's smoking, but if you are inhaling secondhand smoke, then you are inhaling cadmium. Cadmium is also used as a pesticide. So cadmium, very, very toxic. Aluminum. All you have to do is go into your bathroom in the morning. You probably are more toxic after you leave your bathroom in the morning and you finish washing up and putting your various things on. You're probably more toxic than our ancestors were for like years. Bottom line is that most deodorants have aluminum in them, unless you specifically identify deodorants that do not have aluminum in it. Many times a man's shaving cream will have aluminum in it, and just a huge amount of bathroom products have aluminum. If you take a look at your toothpaste, you'll take a look at it and you'll see that most toothpaste have fluoride in it. Fluoride is also a toxic substance. On the periodic chart, it is a toxic metal. So you want to try to get toothpaste that doesn't have fluoride in it. Other toxics, what we call xenobiotics. These are things that are relating to cosmetics that ladies wear, plastics, the water bottles, particularly the thin, kind of cheaper water bottles, have BPA in them. Very toxic. Pesticides. We talked about the toothpaste. Think about your dry cleaning. You go and you take your clothes to the dry cleaners. You go, you pick them up, you bring them home, you put them into your closet, you take off the plastic, and what are you inhaling? You're basically inhaling toxins. Even if it's in organic cleaners, they still use certain types of removers to remove stains. And so you never should put your dry cleaning in your closet or anywhere where you're going to be in your living quarters. You should take your cleaners, take them home, put them in your garage, put them out on the deck, hang them out the window, put them in your attic, put them somewhere for at least a week, so all of those fumes that are emanating from your brand new dry cleaning, which looks nice and clean, but that's toxic. You put it in your closet, you're going to be inhaling toxic chemicals for the next 3 weeks. EMF fields. The fact of the matter is that you all are either watching this either on a DVD or you're looking at it on the internet, and even though these things are great, they have drawbacks. Electromagnetic fields. Anything that is electromagnetic, whether it be a cell phone, a computer, high tension wires, areas where there are Wi-Fi, power lines, all of these things emit electromagnetic fields, and they have a negative or detrimental effect on our bodies and also on our cells. Other toxins. You've got to be very mindful, even if you're taking supplements. What kind of supplements are you taking? Unfortunately, many of the supplements that you get out in the various chain stores that are in your area do not have a whole lot of vitamin in the product. There are a lot of additives and extenders and modifiers and sugars and things like that, starches in the vitamins. So, you may think you're getting 500 milligrams of vitamin C when you may only be getting 250 grams of vitamin C, and all the other stuff may be something else, because you have to understand that vitamins are not regulated. So this is the reason why we specifically deal with certain vendors, and we provide the vitamins for you in your protocols. We know that those vitamins are potent. They are contain what it says on the label, and this is one of the reasons why we get the great results that we do, because we know that when we provide a nutritional regimen for you, and we ask you to take your vitamins once a day or twice a day or 3 times a day, and you take the vitamins that we provide for you in the protocol, we know that we're going to get the results, because the fact of the matter is that we know from the companies that we deal with that primarily just work with physicians. They don't really, sell to the general public. These vitamins and homeopathics and supplements that we're going to provide for you are actually what they're supposed to be, and you're going to see some fantastic results. So many supplements have tons of fillers in them, as we talked before. I'll give you a good example. Ascorbic acid is not natural vitamin C. And if you take too much of it, it can actually cause stones in your body. So even though you think you're doing a good thing by taking ascorbic acid, you may be actually causing a problem. So you have to just really understand that even if we want you to take your vitamins, but we want you to be mindful of what you're taking and what else you may be taking that could be toxic in your system. Anytime when you go shopping and you see something that says enriched, run away from it. Because what enriched really means is that that particular product has been enriched because it has been destroyed from either heating or processing or some other type of system, and most of the nutrients have been depleted. So the food product has very little nutrients left, and so they have to enrich it in order to be able to even get it to the shelves. Usually when it says enriched, it means that they're using some kind of iron ore, and it's not a type of iron that is easily absorbable into the system. They use iron ore, and that actually also can cause a problem. It's also toxic to your system. So you have to understand the type of, or the form of the vitamin that you take is very important in terms of its absorbability. Body reactions to toxins. Your body only knows to do one thing. If it identifies something that's foreign in your system, all it knows to do is to attack. That's what your immune system was designed for. If there's something foreign, attack. Whether it's mercury, or whether it's some kind of pesticide, or some kind of heavy metal, the body attacks. And so if something foreign gets in there, the body will try to kill it. And it won't give up, so it keeps attacking. And sometimes your tissue, your good tissue, can become destroyed in what we call friendly fire. So the immune system is actually working too well, and it's actually identifying things that are toxic, and so it begins to kill it. But in that process, it begins to develop an autoimmunity and actually begins to kill your healthy tissue also. And that's a process that begins to develop, and we want to stop it, and we want to reverse it. Infections. Low-level stealth infections that the body has a hard time totally eradicating. A very good example is the amalgam in your teeth. Okay, there are a lot of different types of bacteria and viruses that can kind of get lodged in your fillings that can cause a variety of infections. And these infections can spread throughout your entire body. They can hide in places the immune system just can't get to. I mean, your body's trying to kill them, but it just can't get to certain areas. Really good example, if you have any old root canals, chances are very, very good that there are probably some infections that are developing there because they've been there for such a long time, and as a result of that, the body just does not have the ability to be able to kill them. Something that you may have heard of before, something called cell wall deficient bacteria, that can literally create havoc to your body. The cell wall, as you know, is what surrounds the cell. If that cell wall is deficient because there are various types of bacteria or viruses in that cell wall, now the cells cannot interact properly. What we call the mechanism of a lock and a key doesn't work anymore, because if the cell wall is normal and healthy, then the nutrients can go in, or the hormones can go in, and they can open up the key to the lock and allow nutrients to be able to go into the cell. If you have a situation that is created by toxins called cell wall deficient bacteria, then it creates havoc, because now the body recognizes even the cell wall as something that is foreign and not supposed to be there, and so it'll attack. The body will literally attack good cells that have a deficient cell wall. MRSA, you may know, is something that occurs primarily in hospitals, and it's very simply very resistant to bacteria and viruses. And the reason that they're so resistant and resistant to regular medications or antibiotics is that they use so many different medications in the hospital, and as a result of that, with the germs and the bacteria and the viruses being there, they become stronger and stronger and stronger and stronger, to the point where the regular antibiotics don't even kill them anymore. MRSA literally kills more people than Parkinson's disease on a yearly basis. So I mean, this is just huge in terms of the amount of toxins that literally live in a hospital, and they're an extremely resistant type because they're constantly being bombarded with all kinds of medications. It's not just about the antibiotics you take, but it's the amount of antibiotics that is in our food. Think about it. If you are a meat eater, we strongly encourage you to begin to eat antibiotic-free beef or chicken or turkey, whatever it might be, and try to allow it to be free range as opposed to processed in an industrial factory. The fact of the matter is that these cows and pigs are pumped up with antibiotics to reduce infection, but that antibiotic still stays in the meat when you eat it. Have you ever noticed, if you ever go to a grade school or a middle school, how the kids are so much bigger on average today than they were even 20 or 30 years ago? And the reason for that is because the foods that they're eating have huge amounts of growth-stimulating hormone and antibiotics in them, and as a result of that, the development is much faster. Girls begin to develop breast, and they begin to have their period at a much earlier age because of all of these chemicals that are in the meat that they're eating. If the liver is overwhelmed from all of the toxins that it must deal with on a day-to-day basis, infectious agents can spill into our bloodstream and literally become systemic. So the liver and the kidneys, they're working like overtime. They're working so hard to be able to get these things isolated, but because of the fact that they're overwhelmed, these things begin to seep into the bloodstream, and then they actually cause reactions in other parts of the body. Food allergies. Another person. The proper term really is not food allergy, but it's food sensitivity is a much more accurate term. We do the testing in our office here via the blood to be able to see what types of foods may cause inflammation in your system. And understand something. These could be foods that are very healthy for you. We've had some people who have been tested with this, and they've been allergic to things as simple as, mushrooms or strawberries or broccoli or, various types of greens. Things that we would normally think are good for us are creating an allergic reaction because of the toxins that are affecting our systems. So a sensitivity is different from an allergy, as it causes a much deeper immune reaction. Foods that you're sensitive to don't have to be unhealthy. So that, like I mentioned before, there could be a healthy food, but you could be literally sensitive to it, and it could be causing inflammation in your body. Leaky gut. If you have been intaking the standard American diet, it is a slam dunk that you probably have a leaky gut syndrome. What is it? It's simply a situation where the foods that you eat, because they're so processed, there's so many chemicals and so many pesticides and so many toxins in them, that these foods actually drill holes through your stomach, and these toxins then begin to get into the bloodstream, and they begin to circulate throughout the entire body. Simply, the food that is supposed to stay quarantined in your stomach gets out and into the bloodstream. The body sees it as something foreign, and the immune system attacks because it's not supposed to be there. It's not supposed to be leaking out of the gut and moving into the systemic system. It's supposed to be digested through the stomach and then ultimately into the small intestine and the large intestine and ultimately eliminated. But when it seeps out of that gut and it goes into the bloodstream, then the body recognizes those things as being toxic and they attack. And that relates to problems like irritable bowel syndrome and reflux and those types of situations that occur. The digestive system is a major battleground where the fight to resolve autoimmunity is waged. You cannot begin to believe how important the gut is. So we got to get the toxins out of the gut. We got to clean out the gut. We got to make sure that this leaky gut situation does not occur, because it will continue to infect and intoxify your system and prevent you from getting well. 80%, and I didn't know this until recently, 80% of your immune system is in your gut. So the gut plays an extremely important role in terms of your immune system and making sure that you're protected. Hormones. Toxic estrogens will drive an autoimmune disease. So if you have imbalances in your estrogen levels, that's definitely going to make an autoimmune disease worse. This is why you see changes in symptoms when hormones change. After a person goes into menopause, things change. After a woman has a baby and gives delivery, things change. After a menstrual cycle, things change. So these differences in hormone levels, okay, and the levels of estrogen in the system, and other hormones too, will definitely have an effect on autoimmunity. Things like birth control pills or xenoestrogens, which are simply the plastic that we drink our water out of, the BPA that you drink your water out of in the plastic. These are considered xenoestrogens. These are dangerous types of chemicals that have an impact on our hormonal system. And so when you are putting your fluids in a container, you want to make sure you put them into a BPA-free container so that you don't have the toxicity coming out and leaching into your water as you drink it. Genetics. Did you ever wonder why you were fine and then all of a sudden a problem came on? Like you were doing fine, you felt fine, maybe you went for your annual physical, and all of a sudden the doctor diagnoses you with the disease. Okay? The answer is you turned on a bad gene. How did you do that? Probably from all the things that we mentioned so far. It was either some kind of toxin, maybe it was something coming out of the fillings, maybe it was something that you ate in the food, maybe some pesticides or antibiotics or some growth stimulating hormone, but something occurred that turned on a bad gene. Our goal in terms of our protocol is to find out what the problem is, what the inflammatory marker is, find out what that bad gene is, and then turn it off again. In a study in the early 2000s, they did what we call the human genome study that founded epigenetics. Epigenetics is a completely new or relatively new study of genetics. And really what they found is that genetics is really not going to change. Your DNA is really not going to change. But there's another whole level above genetics called epigenetics that has a lot to do with how healthy we are and the genes that turn on or turn off and what kinds of conditions, autoimmune conditions that we develop. So epigenetics, the question is, how do you turn these genes back off? Once those bad genes turn on, how do you turn those genes back off? And the answer to that is methyl groups. And methyl groups is just very simple. And it's just basically combinations of carbon and hydrogen. But what methyl groups do is they are a chemical compound that run over 300 different processes in the body. And once these are done, they shut off the bad genes. So our protocols are obviously going to improve methyl groups, primarily in sulfur types of derivatives, because we recognize the fact that we have to do something to be able to turn off these bad genes so we don't perpetuate the autoimmune condition. Methyl groups, if they are out of balance, they literally can cut off your ability to be able to absorb B vitamins. So now do your research. B vitamins are very instrumental in all healthy types of body functions. I mean, extremely healthy, from B1 all the way up. And so the fact of the matter is that if you do not have adequate amount of methyl groups in your system, you literally are not absorbing your B vitamins. You could be taking the best quality vitamin around, but if you're not allowing the body to be able to produce those methyl groups to allow you to be able to absorb those B vitamins, they're just going to go in one end and come right out the other. So methyl groups are made from stomach acid and an adequate amount of enzymes in the body. So the body has the ability to be able to create these methyl groups. We just have to make sure that we kind of jumpstart the system, provide the proper nutrients so that you can once again begin to have a sufficient amount of methyl groups. So if you have a leaky gut, that is definitely a bad thing, because now these toxins are beginning to get into your bloodstream, and then once again they are identified as foreign invaders, and when the body sees a foreign invader, it attacks it, and ultimately it's going to create friendly fire and attack good healthy cells. So pathological detox, we want to talk about this because one of the steps of our program is to detoxify your system. This is a term we use when people get really sick when they go through a detox program. It may have happened to you. You went for a detox, you did some kind of detox, it was not monitored by someone in the know, and you got really sick and you didn't do it again, because who wants to feel bad and get sick? And so we do these things, but we do them in the correct way so that you don't get sick from detoxifying. If you detoxify yourself too fast, you will get definitely sick. So you have to make sure that the detoxification is a gradual process so that we can detoxify you without getting you, having you to get sick. You have to be sure that your body has everything it needs and your organs can handle detox before you start. So we do it in a very methodical way so that you don't have to have any discomfort or get sick, but you are still detoxifying yourself. You can do more harm than good if you try to do something on your own and you do it the wrong way. suppression. So what do you think happens if all of this is going on in your system and the solution is to crush your immune system's first line of defense? What do you think happens? Your body needs its immune system. And so when you suppress it with drugs and medication, that's not a good thing. It's great for the short term, sure. For a short period of time, it's fine. It's giving you a good result. But over a period of months and years, suppressing your immune system is going to cause other problems. Other problems are going to begin to develop because your body is under attack and it doesn't have the necessary defenses to be able to make sure it protects itself. Chronic inflammation. All of these things that we've talked about cause chronic inflammation. As I mentioned before, the test that we do that identifies what foods cause inflammation, very, very helpful test because now you can know what you can eat and what you can't eat. And like we said before, it doesn't necessarily have to be something that's bad, but it still can cause inflammation. Chemical markers called cytokines that the body uses to clean up this damage. So it's very important to make sure that the cytokine level is at a level that's going to allow it to be able to clean up the inflammation that has occurred. Short term, once again, extremely helpful. Long term, continues to cause more and more damage. Now, tumor necrosis factor alpha, this is something that we'll be testing in your blood work, and what it is a very potent immune modulator. It balances out the immune system. But it can be found, if it's out of the normal range, it can be found in rheumatoid arthritis, ankylosing spondylitis, inflammatory bowel disease, Alzheimer's, dementia, Parkinson's disease, and many types of cancer. This is a very important marker that we identify to see what actually is the cause of your autoimmune condition. Also, it can cause depression, multiple sclerosis, and also cardiovascular disease. So in 2007, the National Center for Biotech identified the correlation between tumor necrosis factor alpha and a person's level of autoimmune disease, and it basically related it to these various types of autoimmune conditions. So very, very important marker as it relates to us finding out what's really going on. Interleukin-1, also one very important marker, major pro-inflammatory tissue damage. So we'd have to look at the interleukin-1 to find out, where is this inflammation coming from. It can cause inflammation based on losing your eyesight. It can cause hearing loss. It can literally cause your organs to shut down. It can cause neuroinflammatory breakdowns between the brain-body barrier. It can raise the MMP, which destroys tissues rapidly. Autoimmune diseases, neurodegenerative diseases, lymphoma, multiple myeloma, cardiovascular disease once again, and also type 2 diabetes. So very important factor. Interleukin-6 will raise your CRP levels. It will also be a factor as it relates to cardiovascular disease, chronic lymphocytic leukemia, cancers, anemia, liver damage. It destroys the immune system cells and also is involved in COPD. 98% link it to a very low DHEA, which is a hormone. It's generally speaking, it's a stress hormone, and that can affect your ability to be able to sleep at night. So see how all of these things are kind of connected. And so that's why we do the very thorough evaluation to find out where do we start. What is it that's going on in your body that we need to eliminate first and then provide the proper nutrients. Interleukin-8 inhibits antiviral activity. So if interleukin-8 is out of sorts, it's going to increase the possibility of there being some kind of viral infection, possibly chronic liver disease, bladder cancer, kidney disease, prostatitis, a non-Hodgkin's lymphoma, and also pulmonary infections. So when we're looking at autoimmune disease, you can begin to see that there's so many different conditions that are connected to autoimmune disease. And so we do the research, we do the tedious review of the lab work to be able to determine which one of these markers are out of sort and what is the best way to be able to get them back to normal levels. So some other inflammatory markers are HSCRP, fibrinogen, PLA2, myelin peroxidase, uric acid, free fatty acids, and of course homocysteine. So of these, chances are very good in your normal blood work. You probably had maybe your homocysteine checked, and you may have had your uric acid checked, but a lot of these other inflammatory markers are not even checked in your routine blood work, because there's really nothing that traditional medicine can do for it. And so if traditional medicine can in some way change it or have a drug for it, they don't even bother doing the tests. We have the protocols, the natural protocols, that will allow us to be able to get these inflammatory markers back to where they're supposed to be. Acid versus alkaline. pH is a very crucial aspect, and you must be alkaline to heal. We have our alkaline water here in the office, which we all drink. Alkaline water cleanses the body. It cleanses the colon. It gets your system back into being alkaline. We'll teach you how to eat more alkaline foods versus acidic foods, so your body can become more alkaline, so you can increase the possibility of your healing. So we generally have you check your first morning urine pH to get an accurate measure of how alkaline or how acidic you are. And this will kind of tell us where we're at, what we need to do to be able to get you from acidic to more alkaline. The more acidic the environment, the more the toxins can get stuck in your body. And you don't want those toxins to get stuck in your body. You want to get them out so that your body can function properly. So traditional lab work, probably you've had multiple lab works done on you. Maybe your doctor has it done once a week, or I'm sorry, not once a week, once a month, or every 6 months, or every year. Maybe it's once a year. But do heavy metals show up? Do you see any heavy metal labs being done on you? Do you know what your levels of mercury or cadmium or nickel are? Probably not. Do low-level infections show up? Okay. Are those inflammatory markers done? Probably not. Does leaky gut show up? We have tests specifically that will identify if you have leaky gut and if there are things getting out of the stomach into the bloodstream that are toxic, causing your body to attack. Do they even bother to measure inflammation? And the fact of the matter is that all the things that we just talked about, all of the interleukins and things, those are inflammatory markers that we check to see if you have inflammation in your body. Do toxic estrogens show up? Do they do blood work on to see how your estrogen levels are? Do they do food sensitivity tests when they do your lab work? Probably not. So how are they going to tell you what types of foods you should avoid to reduce the possibility of inflammation? This is what our program and our protocol is a part of, to look at the details, to find out what the labs are saying as it relates to inflammatory markers, heavy metals, hormonal levels, and also food sensitivities. So no, at least not if you don't ask for them to be done. So if you don't ask your doctor to do some of these tests, they're not going to do them. They're going to basically do their routine, blood tests that they do. They're not looking for any of these other things because they don't really have any kind of strategy to be able to treat it. And in medicine, if you don't have a strategy to treat it, you generally don't look for it. Okay, so you have to ask for these labs to be included in your regular blood work. So what's the first step? The first step is proper lab testing. Now, yes, if you have some labs that have been done within the last 6 months, please bring them in. That will give me some insight into where you are and how well you are doing or how bad you're doing. But we still want to be able to do proper lab testing for you. We want to make sure that we send you out to our lab. We will tell them exactly what tests we want them to run on your blood work, and then we'll get that test back. And as soon as we get that test back, I will tediously go through that lab work to be able to see where you are. Now understand something. Your regular blood work normals are probably a relatively wide range. Okay? And so there's one thing to say that it's in the normal range, but it's another thing to say it's in the optimal range. And so our labs are going to have an optimal range because we want you to be optimal. And we want to make sure that we do things that bring you not just in the normal range, okay, of being within normal, we want you to be in the range of being optimal. So we got to do the proper lab testing to see. The labs will have inflammatory markers, they'll have gut markers to see if there's any leaky gut syndrome, hormone markers, food sensitivity markers, immune system markers, infection markers, and also toxic metal markers. So I don't want to get too complicated here. I want to just try to give you an overview because it'd be very difficult for me to be able to go through all of this information when you show up in our office. That's why I took the time to be able to put this DVD together. But oversimplified, we want to remove the toxins that are causing the reaction that you're having. So that's our first and foremost. We want to get the bad stuff out. Secondly, we want to restore the balance to your systems. We want to make sure that we restore that balance so the hormonal balances in your body are once again normal. And then lastly, we want to set the protective mechanism so that it does not happen again. We don't want this autoimmune problem to return. So we want to make sure that we set up and correct the system to the point where it's stable enough so you'll be able to function without having an autoimmune problem down the road. So this is something that we work very, very hard on to get the system stabilized. A step-by-step process. Okay, so first things first. We want to stop the damage that is occurring right now. Okay, high blood sugars, high inflammatory markers, they are doing damage to your body every single second of the day. So we don't want to waste a lot of time. If you are a candidate to be able to receive our program and we decide to accept you as a patient, we want to get started just as quickly as possible because we don't want any further damage to be done. So our first goal is to stop the damage, and we have protocols that we'll be giving to you and things we'll talk about in just a little while in our office in terms of your treatment that will help us to accelerate that process of stopping the damage. Now, is diet important? Can you continue to, have cheeseburgers and Snickers? No. You've got to make sure that you eliminate the number one probably substance that's causing you probably the most trouble is sugar. Okay? You've got to substantially reduce the amount of sugar that you're taking into your system. And it's in everything. I mean, it's in your ketchup, it's in your salad dressing, it's in high levels of bananas have a large amount of sugar in them. Lemons have a large. So you have to understand that even some things that may be good for you may still have large amounts of sugar. And we want you to ask you to cut out the sugar and get it to a minimal as best as you possibly can. Yes, your body needs glucose, but it doesn't need that sugar because it is inflammatory. We want you to stay away from processed foods. We talked about all of the chemicals that are dumped into processed foods. Okay, if you're eating these processed foods or these fast foods, then you're dumping these chemicals into your system, and you're causing a situation where it's making it very difficult for your body to eliminate or to detoxify yourself. Many of you are gluten sensitive. 46% of our population is. There's been a lot of talk about gluten recently. So if gluten is causing an inflammatory reaction in you, I would say eliminate it. For most people, eliminating gluten is going to be a good thing for you because it's going to reduce the inflammation that is occurring in your body. Soy. For some people, soy can be inflammatory. I don't recommend anybody eating lots of soy. Obviously, fermented soy products are much better than just regular soy products, but you want to cut down on the amount of soy you have in your system also. Dairy. 60% of the people in our population are sensitive to dairy. I would suggest cutting it out to the best extent that you possibly can. If you are going to have dairy, I would definitely do antibiotic-free, organic, raw cheeses and things like that if you have to have it. But most of it is processed. Obviously, your milk is homogenized and processed and pasteurized. And, there are chemicals in there because there were chemicals given to the cow. And so the fact of the matter is that reducing or completely eliminating dairy is going to help you move along very quickly. Whatever you are sensitive to, and you know probably better than we do, at least initially before the blood work comes back, eliminate it out of your diet, okay? Because it's just causing inflammation and infection in your system. Step-by-step process. Find out what is in the system that's causing the immune system to become confused. Because there's something in the system that's causing this immune system to just go berserk. It's not functioning properly. So if you know of something that you're taking into your system and you have maybe a kind of funny feeling with it, or you become tired very quickly, or you have some kind of stomach upset, that's your body telling you that that's not good for you. So eliminate it out of your diet, okay? Make things a lot easier for you, and it will reduce the confusion at the immune system. We use kinesiology a lot. We have found that many times finding these markers or these causes are like finding a needle in a haystack. So we will be checking you in terms of muscle testing to be able to see exactly what things are causing inflammation in your system. And so this is a very great non-invasive way of being able to test you for something. And maybe there's something that you like. bring it in. We'll be happy to test you kinesiology to be able to see if what you are taking into your system or what you're putting on your skin could be creating an adverse reaction for you. Begin the detoxification process. Start drinking more water, preferably alkaline water. Hydrate yourself more than you've ever hydrated yourself before. Begin to eat healthier, more greens, more salads, more fruits, more beans, mushrooms, onions, ginger. Just begin to eat more natural, more healthy. Now we're going to be giving you recipes. I'm going to be giving you a food journal so that we can see how you're currently eating right now. And we're going to go through that, and we're going to make sure that we give you alternates or suggestions on how you can improve your diet and begin the process of detoxification. Now, this is not all of our technology. This is a list of some of our technologies here. We're going to be using things that you probably have never heard of before, but some of the things that we're going to be using are going to once again reinvigorate your cells and allow them to begin to develop healthy patterns as opposed to unhealthy patterns. So first thing we have here is frequency generators. You're going to be using these because these help to neutralize toxins and infections so they can be detoxified safely. Remember we talked about how important it is to detoxify in a systematic way so that you don't begin to get sick. We're going to be using our contour red light therapy. Very, very good for tightening up the collagen, increasing the circulation, and allowing your body to be able to eliminate fat cells. The imprinter is a fabulous technology that allows us to be able to very simply eliminate the bad bacteria and viruses into your body. And it's just a very simple, painless procedure that we do that literally eliminates a lot of those bacteria and toxins out of your system. We're going to be using an oxygen concentrator with you. What we have found is that if we can begin to regenerate and reinvigorate that brain, the brain drives everything, okay? The brain is the master control over the entire system. So if we can begin to get more pure oxygen into the brain area, that's going to help that brain to begin to function better and to be able to drive and control the body the way it's supposed to. Hydro massage. We're going to be using that in conjunction with our MindFit. I'm going to give you a set of headphones that has some nice relaxing sound to it. And we're going to change things from a psychological point of view to allow your body to be able to get into a state where it can begin to heal itself more effectively. And while you're listening to those very relaxing sounds, we're going to put you on our hydro massage bed so we actually can be increasing your circulation and allowing you to be able to relax. It just really feels great. And then microcurrent. Once again, microcurrent is something that we're going to be able to do on you that allows you to be able to eliminate a lot of the bad things that are in your body, like bacteria and viruses and other types of toxicities. So these are some of our technologies. As we begin to go through the program, we'll go into more detail with you about exactly what you're going to be doing and exactly what the benefit is for each type of technology. We're also going to be using homeopathy. It allows us to be able to support your organs naturally. It allows us to be able to target individual toxins to allow a much faster excretion from the body. So when you're using homeopathy, it's just really very powerful. And if you have an issue with maybe liver toxicity or kidney toxicity or some other organ toxicity, we can direct the homeopathics to be able to focus on those particular organs and be able to pull those toxins out of those organs much more effectively. We're going to be, as I mentioned before, supporting the brain function. The oxygen generator and other types of the contour light we're going to be doing are going to be supporting your brain function, so your brain is energized to be able to send the signals to the various organs and muscles and glands, allowing them to be able to function much more effectively. The brain basically needs three things. It needs activation, and we're going to activate it. It needs fuel, so we're going to provide the proper nutrition for it in terms of supplements. And it also needs oxygen, and that's what that oxygen concentrator is going to do, is it's going to bring more oxygen to the brain. We're going to support your epigenetics. We're going to be doing things that are going to support those things that are outside of the DNA that we can control. We're going to turn off those bad genes and turn on the good genes once again. We're going to rebuild your gut. If you have leaky gut, or you have a situation where your stomach acid is not appropriate for digesting your food, we're going to create strategies for you to be able to help us get that back to normal. And once again, the blood work is what's going to give us the roadmap to let us know what types of supplements, what types of homeopathics. What types of things do we need to provide for you if in fact you have a leaky gut? Now, if you don't have a gut issue, then we're not going to treat it. We're going to basically treat the things that we find to be abnormal on your blood work and through our testing here. And most importantly, we're going to balance your immune system. We talked before about the time about when you have that imbalance in that Th1 and Th2 system, that really is the definition of autoimmune disease. So we're going to balance out that immune system so both of your systems, both of your armies that protect you will be able to protect you effectively, as opposed to one trying to do all of the work and the other one not functioning properly. We're going to restore the protective balance of your body. You're going to feel great. It's going to be amazing. You're going to feel younger. You're going to have more energy. You're going to be able to wean yourself off of the various medications. And by the way, we do this all in conjunction with your doctor, so we don't arbitrarily tell you to not take something that you're currently prescribed. We're going to have you go back to your doctor at a particular time when we think that a certain amount of changes occurred, and you're going to ask your doctor, I'm taking these medications and I'm receiving some other types of treatments. Can you evaluate me to see if we can maybe begin to reduce some of these medications that we're on? And we'll even send your blood work that we do on you here, we'll send it to you, with you, to your doctor's office so that your doctor can see the improvements in the various inflammatory markers and things like that. So we're going to restore and balance your body. So, chronic conditions versus acute conditions. If you're watching this video, chances are very good you have a chronic condition. So most of our patients usually come here when they've gone every place else. They've tried everything else and it hasn't worked. So chances are very good you have a chronic condition, and I will be very transparent with you. A chronic condition is going to take a bit longer to reverse than an acute condition. But if you have an acute condition and maybe you are pre-diabetic, and you don't want to become diabetic, or you have some type of issue that you want to try to prevent from occurring, we're going to take care of you also. We'll take care of both the chronic and also the acute conditions. Generally speaking, the acute conditions are generally shorter treatment times. We are in a pharmaceutically driven healthcare office, and so we're not against the use of pharmaceuticals. We're just against the abuse of them. And I tell you, sometimes people will come into our office and they will literally bring us 3 and 4 and 5, or sometimes even shopping bags full of prescription drugs that they are currently taking. Okay? This is not the answer. The chemical approach to getting well has just been refuted. Yep, for the short term, it's fine. But for the long term, there's so many adverse side reactions that occur from a person taking so many medications. It just devastates the body. It just completely attacks the immune system to the point where other systems begin to shut down as a result of all of the medication that this person is taking. Okay? So even though the appropriate use of pharmaceuticals we're certainly in favor of, but we just see people coming in that just are taking so many, sometimes they even duplicate types of medications that they're taking, which we just truly feel is doing more harm than good. So, if we accept your case, we will be able to get you better. Okay? That's why we want you to bring in your labs that you already have. We will review the labs when they come in if you get it through our office, and we will help you if we accept you as a patient. We're going to work very hard to be able to find out what the cause of the problem is. So I want you to understand that the problem that you have, it's not a death sentence. Okay? You may have thought that you had to deal with this autoimmune disease for the rest of your life, that you'd be on medication for the rest of your life, and I'm here to tell you that it can be reversed and we can get you off of your medications. So it does not mean that you can't live a full and healthy life, but you have to take control. You have to make the decision and say, okay, I'm tired of living like this for the last 5 years, 10 years, 20 years, 30 years, 40 years. I want to take control of my health. I want to begin to reverse these autoimmune processes that are occurring. I'm going to do what Dr. Davis has asked me to do because I'm committed for the next 6 months or a year or whatever it takes to be able to reverse these diseases. So it has to be your decision, and we only want to work with people who are seriously interested in reversing these diseases. Because like I said, if we accept you as a patient and you begin the protocols and you do them, you're guaranteed to be able to reverse the disease or greatly improve it. Purpose of this video, to give you back your control of your life. Okay, I've given you huge amounts of information in terms of how you got sick. I've given you some of the strategies in terms of how we're going to get better and reverse these diseases, because I don't want you to stay sick. My purpose in life is to allow there to be more people less sick. I feel that life was designed and developed to be enjoyed, not to be, have sickness, not to be able to function, not to be able to do the things that you want to do, not to be able to get a good night's sleep, not to be able to, catching colds or, having to take all kinds of medication. My feeling is that there is a solution to your problem, and we want to be the doctor in the office that figures it out. So don't stay sick because of what somebody else says, okay? Because there may be other people out there who are saying, oh, no, it's impossible what they're saying that they're doing. I wouldn't even bother. It's just a waste of time and a waste of money. And I say, don't listen to them, okay? Because we understand what we see in our practice. We understand and we see the results of people who come in here probably a lot worse off than you all out there watching this, and we have been able to reverse these autoimmune diseases, okay? So don't give up, and don't let anything that anyone else says discourage you from taking that first step to once again regain your health. Knowledge is not power. Knowledge is neutral. It's what you do with the knowledge that makes it powerful. Okay, so you always hear people say knowledge is power. Yeah, you can have the knowledge, but if you don't do anything about it, guess what? You're in the same situation. You're just smarter. Okay? So knowledge is power only when you apply it. So we want you to take that first step and say, yep, I'm going to commit to doing the program, and we're going to reverse the disease and allow you to live a healthier life. Information without action is not going to help you. You have to take massive action for yourself. Remember, this is for you, okay? I treat, my family members, a lot of my family members have chronic diseases, and we are utilizing these technologies on them, and we're reversing their diseases. So we see in our patient population how these types of strategies can help people, all right? So take massive action step, make the decision to take that first step to begin to help yourself in reverse disease. Our rules for working together. You have to be willing to make lifestyle changes, and that includes diet. So you got to begin to eat better. You can't, continue maybe some of the bad habits that you currently have. And we'll guide you through that. We'll give you recipes. We'll go through your food journal. We'll see what it is that you're doing right now and be able to try to help you and hold your hand and guide you into a better way of eating. Now, I got to tell you that insurance is not going to pay for everything, okay? Insurance will pay for a portion of your care, but it's not going to pay for everything. So it is also a financial commitment. Most of our patients, when we verify their insurance, they're looking to probably put towards their care about $250 per month to be able to receive the care that we provide here. Sometimes it's a little bit less, sometimes it's a little bit more, depending on the insurance coverage. But we'll go over all of those details with you once we get your insurance verified. And one thing I want to mention to you is that we primarily work with people who have nowhere else to go. They've gone to everything else. They've done everything else. They've tried different kinds of strategies and diets, and this is usually, generally speaking, the last stop for them. So we are very, very intentional in terms of making sure that we can find their problem and reverse their problem. When you start the program, everything that you need for the program in terms of supplements and vitamins and protocols, everything is included in the program. So you don't have to go out, to the local health food store and go and buy a certain kind of vitamin. We provide everything for you. So it's a one package deal. You don't have to worry about getting the right vitamin or the right form of the vitamin or the right form of the enzyme or the homeopathic solution. We provide everything for you. Why? Because we know that the nutraceuticals that we use are time tested. We know that if you take, let's say for example, the vitamin C that we recommend, we know that it's going to have a positive effect on your body, okay? Because they've been time tested. So we don't want you messing this up by going out and saying, well, I'm going to get my own vitamins and try to figure this out myself. Trust me, it's not going to work, okay? Follow our protocol. We provide everything for you. We'll give you a full layout of everything when you come into the office. We work with people basically that have nowhere else to go. And so we're very serious about helping them. So, people will come to me and they'll say, Dr. D, I'd love to start the functional nutrition and care plan, but I don't have the money right now. And what I say to you is, find it. Find the money to do it. This is a life-changing experience. You don't want to have to pay out the money because you are diabetic. There was a research study that was done that if you're diabetic, you're basically paying close to $8,000 per year in care. $8,000 per year in care. If you have heart disease or some kind of cardiovascular problem, you're paying out about $6,000 per year. Okay? So the fact of the matter is that think about, how is this going to change your quality of life? By doing the program and sacrificing yourself for maybe 6 months or a year, whatever it might be, how is it going to affect your life? How is your problem going to affect your relationships, your finances, your family, or other activities? What has it cost you in time, money, and happiness, and also sleep so far? So that what does it cost you already? Because you're suffering. You've got these autoimmune issues and you're not functioning at 100%. Where do you picture yourself in the next 1, 2, 3, 4, or 5 years? If this problem is not taken care of, is it going to get any better with what you're doing right now? Probably not. Chances are very good that your condition is going to get worse if you continue doing the things that you're currently doing. Okay? So we want to try to help it. We want to try to change and improve your quality of life. So you have to ask yourself the question, what is it worth to you if we could improve your life, reverse these autoimmune diseases, and get you back to maybe the way you were 10 or 15 or 20 or 30 or 40 years ago? That's what you have to ask yourself, and is that worth it? So, ready, set, go. If you want more information, our website is davisintegratedmedicine.com. If you'd like to set up a consultation, our number is 973-783-3606. Once again, if you've taken notes during this presentation, if you have questions, please write them down when you come into the office. I'll be more than happy to answer any questions that you have. And remember, my purpose in life is to allow there to be more people less sick. And so we are reversing these diseases that were once thought to be diseases that would last you for a lifetime. So we put the time, the energy, and the knowledge into helping people do that. Take the first step. Thanks so much, and have a great day.